Hey guys, my name is Hannah. I'm a current University of Melbourne student, although I'm actually home in Calgary, Alberta, Canada right now. I've been home through most of the year actually. I've only spent 1 month in Australia, and then of course everything happened, so here I am. So I guess what I want to do today is show you a little bit about how my day goes. How I spend most of my days right now. I'm considered the receptionist and technician assistant, of course. Usually I'm masked up, but if we are after hours right now because I wanted to give you guys a chance to see who I actually am. And so most of the day I spend checking in patients, taking kind of an initial history, make sure that what they're here for is what we have in our schedule. And then, of course, if we have any procedures or nail trims or anything like that, I help out and often will hold and really get to harness my holding skills, which is actually quite an art. So I'm very grateful for that. And so then I, of course, have my little desk set up here. And if we ever have anything really cool come in, I get pulled aside and get to look through whatever they're looking through, whether it be files or an actual patient. My clinic actually does keep some of the tissues for me, so I am able to look at them in a respectful manner, of course, and have some hands-on clinical time right now. So we don't do really large surgeries. For me, it's been great because I get to learn the basics, and it actually kind of coincides with what we do in school in first year. Okay, let's go on a little tour. So first of all, let's see our treatment area. So here we go. This is our little lab. And then if you look back here, this is a treatment table. And so this is actually where we also do our dentals, which is pretty cool. And then if you flip right around here, this is our pharmacy. So over here, we have our little inpatient area. So for our spays and neuters and dentals and various things like that, because we are primary care, they would spend the day here. And over here is our surgical suite. So you can see here we go. So it has all of the good bits, really fun. And of course here you can see some surgical packs that are ready to go for Monday. So over here is one of our patient rooms. So as you can see, we have our little counter set up, and then we have this awesome floating table that has this cool mat on it so that it's easy to clean, but you don't slide around on it, so it's really good for patient care. And then, of course, we have a little wipeable chair for the times. So yeah, that's a bit about how I spend my day. Of course, when I go home in the evening, at this point, I spend a lot of it on my computer. I love to review the cases that we've seen through the day and the conditions, so that way I can kind of put it to memory a little bit and at least have some notes and some record about what I saw on my time off. And really at this point, I've been spending a lot of my time between here, and sometimes I even do overnights the same day at an emergency facility, really seeing as much as I possibly can. It is very draining at this point. And as much as I love it all, tonight I'm really excited to have a really good sleep and just come back in tomorrow and have Sunday off. So